good. Y'all are so beautiful. We are getting ready to start our first panel of the day, and it is on perimental health and its connection to childhood obesity. Y'all look good, y'all. Hey, y'all. So, like I mentioned, this panel is sponsored by the National Coalition of 100 Black Women, the DC chapter, the Metropolitan DC chapter. So super excited about the work that they're doing in supporting Black businesses, Black women, and Black causes. And of course, we have one of our panelists, Sasha Nicole, who is part of the National Coalition as well. But let's get into this. Y'all ready? All right, let me read some bios real quick, because these are some fancy folks. We have Sasha Nicole, who is our advocate and our mom. Sasha Nicole serves in the full-time role as a contracting officer, as well as a part-time facilitator and subject matter expert, teaching the fundamentals of acquisition and project management. She's a member of the National Coalition for 100 Black Women and founded a nonprofit called Partnerm Evolution. I can't wait to hear about it, which is dedicated to globally bringing awareness to on the prevalence of perinatal mood disorders for mothers of color. She also founded the Fearless Influence, which is a leading digital mental wellness company for millennial moms who feel unseen, unheard, and undervalued. Thank you, Sasha. And then we have Jabina Coleman. Hey, girl, my soror. She is referred to as a survivor of perimental health, mood disorder, as well as the founder of, and Jabina is also known as the lactation therapist and is a licensed clinical social worker and international board certified lactation consultant. She supports new and expectant moms on their journey into parenthood, providing psychotherapy, lactation consultation through her private practice called Lifehouse Lactation and Perinatal Services. She's the creator of Everyone Wants to Hold the Baby, but Who Will Hold the Mom? A call to action highlighting Black maternal mental health equities, focusing on awareness, access, accountability, and action. Her work is informed by her clinical and professional experiences, as well as her personal motherhood journey with 2 children, including 4 years of breastfeeding. Let's welcome Jabina. And y'all, Jabina drove all the way down from Philadelphia this morning to be here with us. Isn't that amazing? And we have Dr. Michael Knight. Hey, Dr. Knight. Dr. Knight is a physician, a healthcare executive, and a nonprofit leader. He is an assistant professor of medicine at the George Washington University and currently serves as the Associate Chief Quality and Population Health Officer, Head of Healthcare Delivery Transformation, and is also the Medical Director for Community Primary Care at the GW Medical Faculty Associates, where he serves as the Internal Medicine and Obesity Medicine as well. Where he practices internal medicine and obesity medicine. Dr. Knight serves on the National Medical Association Board of Trustees and is the founder and president of Renewing Health Foundation. Thank you. Let's welcome Dr. Knight. All right, let's get into these questions, y'all, because I have a few. So when we met earlier this week, I asked you all, what were some of your first thoughts about being on this panel, especially this week, because it's Black Maternal Mental Health Week, right? And so it's a special time for us. It's a new concept as well. We haven't always celebrated maternal mental health or acknowledged maternal mental health. And even more, we haven't always acknowledged Black maternal mental health, which is its own thing based off of socialization and cultural issues and values and access to care. Some of your thoughts included sharing information, bringing awareness, bridging resources, being relatable, aiding and support, and teaching and transforming. So as we normalize this particular conversation with our audience, tell us, what is something that you absolutely want the audience to walk away knowing? And I know that's oftentimes a question that we ask at the end, but I think it's a question to start off as well. Before you answer, let me also mention to the audience that this is a conversation. So at any point, if you have a question for the panelists, just raise your hand. This isn't just me asking them questions or them asking each other questions. We want to hear from you too, right? So as they say things, go ahead and ask more questions, all right? All right, so what is it that you really wanted people to walk away knowing? We could start with you, Jabina.
Awesome. So I think one thing that I would love for people to walk away with is just breaking the stigma and the silence, especially around perinatal mental health. As new birthing people and mothers, it's oftentimes really hard to, say that I'm struggling or having a hard time, because many of us didn't see our mothers struggle and have a hard time, or they didn't talk about it. So really wanting to know that we should ask questions about perinatal mental health, break the stigma, break the silence, and talk to your girlfriends, talk to your sisters, talk to your cousins, talk to your aunties, and ask the questions. And for yourself, if you are that auntie, that sister, that girlfriend, reach out for support and help.
Thank you, Jabina. Sasha or Dr. Knight?
I mean, as Jabina said, I think that perfectly sums it up in terms of breaking the stigma, asking for help, talking about it. I think it's important to know that, when we think about perinatal mental health, like Black women are 4 times more likely to die from maternal mental health issues in childbirth than white women, right? We also know that Black women usually are the least likely to get help in these situations when they're going through certain things regarding childbirth. So I think it's important to understand that this is a very important topic, and to take it seriously, and to understand that if you're not feeling yourself, if you're not feeling well, if you're feeling that's okay, and it's okay to actually say something about it, and not ignore it, or think that you can, as we all, that Black girl magic, that strength, like, oh, we'll just push through, because there are instances where we're not making it through.
That's right. That's right.
I think one of the most important things is really understanding the prevalence, because I think a lot of times when we don't have the conversation, people believe it's something that's so rare that it's not something that they're dealing with. Even when they talk to a healthcare provider, a friend, they said, oh, you're not dealing with a disorder, this is just what people go through.
Right.
But the reality is almost 1 in 8 birthing people can deal with a diagnosable postpartum disorder.
That's right.
And so that means if 8 people are pregnant, 1 of them is very likely to be going through this. Very, very common. How many of us have 8, 10 people that we know that are birthing people, have families? That means that risk is very prevalent. So it's very likely that someone that you know in your family, in your social circle, has dealt with this, even if they haven't talked to you about it. And as was mentioned, for Black birthing people, that rate is 1.6 times higher, even though we see less access to care and less diagnoses. So it's a real issue that is in our community, and one of many issues, right? We could be talking about diabetes, we could be talking about obesity, and it seems like our community continues to be the one that is the target. So it's an opportunity for us to be aware, but also for us to talk about solutions. I think that's what we're gonna do today.
That's right. That's right. I love that, Dr. Knight. It's so interesting how you brought up those statistics and information. I know for myself, this topic is extremely personal, because I dealt with my own postpartum disorder after I had my son. And I had a late onset of postpartum, so it wasn't immediate. He was actually about 6 months old before I had that onset. And for me, I was a therapist, so I was like, oh, I see what's happening here, right? But I also recognize that it's a lot of birthing people that are experiencing these symptoms and don't know about it, right? Back in the day, we used to just call it mommy blues, right? Like, oh, you just got mommy blues, you're just trying to adjust, you just had a baby. Like, of course, things are hard right now, and not understanding that it's actually something extremely serious, and it can actually be fatal also, right? And our goal here is to make sure that we're bringing awareness and having conversations, being relatable, so that women, birthing people actually can go ahead and understand what's happening with them. With that, we're also understanding again that today is the end of Black maternal mental health, right? I want you guys to tell me a little bit about your journey into this work. How did you get into understanding what it meant to be a part of the Black maternal mental health community, either professionally or personally? So either one.
So my experience actually started with my pregnancy. My son now is 18 years old, and when I had him for the first year of his life, I didn't talk to any of my girlfriends. I didn't, and these are girlfriends now of 30 plus years. And so didn't talk to any of my girlfriends until his very first birthday. And didn't understand, didn't know why. And I'm Caribbean, so I was not gonna tell my mom that I wasn't feeling like a mom, that I didn't have the strength, that I was crying every day. I also experienced major depressive disorder and postpartum OCD, obsessive compulsive disorder. And I didn't even know it at the time. It wasn't until 2015 when I attended a conference as a clinician, as a therapist, and I was like, check, 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 check. I, met all the qualifications for both and did not know it then. And so being unassessed, undiagnosed, untreated, and still talk about, just thinking about like the resilience that got me through. And so that was a part of my journey, but clinically, being able to work in clinics and work with new birthing people on a daily basis and recognizing that they were struggling just as much as I had struggled, but also did not have language to express the things that they were experiencing. And so for me, that was the start of my journey, just personally, but then also had kickstarted my passion for Black maternal mental health. And so I've been on that journey for the past 15 years, supporting, uplifting, and bringing this information to the community. Yeah.
Absolutely. Thank you, Jabina.
You're welcome.
So for me, similar. Mine started after I had my daughter. She's about to be 11. I did not have an instant connection. So when people, they say as soon as my kid was born, I just instantly fell in love. I didn't feel any of those things. I felt like, oh my God, it's like a real human. So, and I didn't feel this instant just, you're the greatest thing in the earth. And I wanted to feel that way, but it never came. And then I kept waiting, like, when am I gonna feel that way? But I didn't have that connection. I didn't feel affectionate. I didn't feel any of those things. And then as time went on, I felt very violent towards my daughter. When I would look at the steps, I would think about throwing her down them. And when I looked at the wall, I'd want to throw her against the wall. I mean, I had very violent images in my mind of what I wanted to do to my baby. And I knew that this wasn't normal. But I also felt like, how many people can you tell that to? And then similar, my family, my dad, typical Black family, like, girl, get over it. You're not the only one in the world who's ever experienced childbirth type of things. But I knew that this constant feeling of, I want to harm my child is not something that I should feel. I also was afraid to talk to any type of professionals because I felt like they would take her. They'd call CPS, or they'd think that I'm a bad mom, or, if I told my friends, and they'd think the same thing of me. And then she also was sickly for the first few years of her life, which made it even worse with the constant crying and the feelings that I had. And so I remember when I finally went back to work, I was working at this company who was majority white. They had just won a contract where they were supposed to be doing the studies of postpartum in rural communities, and going around the table and hearing them and their thoughts about people who were minorities and how, they just had this completely just misunderstanding of what it looked like. And I'm sitting there like, I'm not underprivileged, I'm not poor, like I'm not rich, but this doesn't represent me. But I didn't identify any other communities that I could talk to. And so that's what prompted me to create Partum Evolution, to start my nonprofit, and to hopefully encourage more mothers of color to be able to have that conversation and to build that community, and to also look at other surroundings. Because for me, there were so many other things and factors that played into that experience. And so that was how my journey started. And now even, wanting to think about from a clinical standpoint of even going down that path, but that was how it started.
Sasha, I think that's amazing. And I also want to say just thank you for being so explicit with the experiences that you had and those thoughts, right? Because like you mentioned, a lot of people, and you guys know the stats, right? You just said the stats, are having these thoughts and so afraid to say anything about it, right? And in some situations, that's how it becomes fatal, because someone actually carries through and then later have all this regret. And all that we needed them to do in the beginning was to understand what was happening with them, to be able to label what was happening with them, and then to be able to have that access to support. So I'm glad that you also created the foundation that gives that access as well. So thank you, Sasha. Dr. Knight?
Yeah, so thank you for that. I think, my introduction to the issue, I want to step back a little bit further. So as someone in training, in medical training, we're learning about different communities, what health issues are the major ones. And we talked about maternal mortality in general and maternal health. But we really didn't get into the details. It wasn't after I was a practicing physician getting ready to talk about health equity that I really looked at the statistics in general when we talk about maternal health, period, which includes mental health. So just to give people an idea, when we talk about maternal mortality, for example, we will count that as how many deaths per 100,000 births, okay? So I say 100,000 birthing people have had a baby. Of those, how many may deal with death within that birthing period, okay? So nationwide, the rate is about 24, right? So 24 deaths per 100,000. And to give you a context, in comparison to other developed countries, so think about the Netherlands, the United Kingdom. The Netherlands is 3, the United Kingdom is 6, Canada is 8, the United States is 24. When we look at black women, that is now 50. Okay, so we've gone from 24 nationally to 50 for black women nationally. And when we think about DC, we're talking about 70. Okay?
Wait. So nationally, it's 24.
Yes.
That's including all birthing people,
All
cultures, all races.
Yep.
But for black people, it's double that.
That is correct. And so if you look at 100,000 black birthing people, that rate is 50. And then if you're looking at 100,000 black birthing people in DC, that rate is 70.
Wow.
When we looked at the data between 2014 and 2018 of all of the deaths in the district with black birthing people, even though black birthing people made up about 50% of the births in DC, it was 90% of the deaths in DC. And for white women, there actually were no deaths in that period. So the other 30%, we're not even talking about white women or white birthing people. So there's a major issue just on the reality of being able to celebrate a pregnancy, right? So how many times you have someone in your family who has shared with you that they're expecting, you're excited, you're getting ready for the baby shower, you're getting ready for the gender reveal, and you don't understand that that person has now entered a phase where their health is critically at risk, their mental health is critically at risk. So as someone who is committed to better health outcomes, particularly for our community, I immediately said, this is an issue we need to talk about because it's not a maternal issue, it's not a maternal mental health issue, it's a crisis. And if we don't know that, and if we can't advocate for that, then we're never gonna overcome that. Those rates are not getting better. And so there's a huge opportunity for us to focus on this.
That's right. Go ahead. Yeah, go.
So also with those alarming numbers, in Philadelphia specifically, for the women who died I think the last statistics we looked at were 2021, 50% of the women who died in the postpartum period had a mental health diagnosis. Right? And so these connections, and I'm going to assume that the numbers are not different here.
That's right.
And so, again, the reason why we're having these conversations about maternal mortality, but also about mental health, because it can also be prevented. And that's the part with when we're talking about other comorbidities, diabetes, hypertension, postpartum mental health can be protected against, right? It's preventable. And so, again, I think that's that key point, that is preventable.
Both of those points are so interesting. I was working with a client a few months ago, and her husband is ready to start a family, and he's like, let's go, let's do it, like, what's going on? And she kept like skating around the issue, right? And then we would have another session and she was skating around the issue also, again and more. And then it got to the point where I think subconsciously it was showing up behaviorally for her, where she stopped wanting to be intimate with her husband. She stopped wanting him to touch her and everything. And when we finally got to it, she said, Dr. Plummer, I'm afraid of dying. I'm afraid of trying to bring life and dying at the same time. Like, I'm young, I want all these things in the world, right? I want to experience all these things. And it was a true reality for her. There was nothing, I mean, like, I get it, sis. Like, I know the statistics, I understand. So we've been working through that, but I thought it was amazing that she had the space in therapy to be able to say, the reason that these things are happening, the reason that I'm afraid to be intimate, the reason that I'm avoiding my husband is because I'm afraid of getting pregnant, and in afraid of getting pregnant, I'm afraid of dying, right? Go ahead, Sasha.
You know, when you said that, it kind of it made me tear up a little, because when my husband and I got married, he wanted to have a child together, and that wasn't something I didn't want to do. We agreed. We said this was something we planned, and as it got closer, and then now with it actually happening, I would cry and express my fear of, you know, the trauma. And, you know, I've had some severe trauma with even, like, you know, when you're pregnant, they have to keep sticking you and probing you. And I've had people hit nerves in my body. Well, you know, so there's so many instances where it has been very painful for me. And, you know, I guess I would encourage, like, it's just that support, you know, having so he, you know, is there for even when they're drawing my blood, because it is a mess. Like, I am like a toddler. Because it has been a very painful experience for me. So to go through that again, it's hard to, you know, if someone like, he can't understand what that's like, but people around you can be supportive too, and take your pain and you expressing that pain seriously, because it is scary, and it is, depending on how it goes. I know I had an emergency C-section that they told me with the epidural, they said, don't look back, and I looked back, and I was like, oh my God.
Girl, you saw that needle shit.
So it is, you know, it is not just some, you know, some people have that, oh, I gave birth in 2 minutes, but that's not the experience for everyone.
Yeah.
Or the treatment after. So, you know, because we haven't even gotten into after you have the baby, and sometimes when you're not listened to, when you're saying, I think there's something wrong. Or, you know, I know for me, when I said my daughter was sickly, and I'd say to the doctors, there's something wrong with her. And they'd say, oh, you're just a new mom. Like, there's something wrong.
Yeah.
You know, so it's a lot that goes into it.
Yeah. That made me think about the case, I'm sure you guys remember, with Serena Williams when she had her baby. And she was like, something is wrong. And even her own personal physician was not listening to her, right? And how often that happens, where we are saying something and people aren't listening. I want to switch it a little bit and talk about the correlation of maternal mental health and childhood obesity. Again, we're so honored to be sponsored today by the National Coalition of 100 Black Women. And one of the focus areas that they have this year is related to childhood obesity, especially in the Black community, and being able to acknowledge it and address it. So at first, when we were having the conversation, I was like, there's a strong correlation between childhood obesity and maternal mental health, right? If a mother is experiencing any type of maternal mental health issue, she's probably neglecting parts of herself, which subsequently means that she's neglecting parts of her child. She's probably not eating the way that she needs to eat, which means that if she's nursing, she's not getting all the nutrients that she needs, and subsequently the baby's not getting all the nutrients that they need. If she's dealing with maternal mental health issues, she's probably also not going out there and seeking services in terms of, like, food, right? Like, what kind of food should I get? How do I navigate these situations? And then we tie all of that into these concepts of food deserts that we're going to talk about a little bit later as well. So the implication is that if a mother isn't taking care, if she's dealing with her own maternal mental health issues, she's probably not feeding the child, or the child isn't getting everything that they need. And then when we start talking about that from an attachment perspective, the mother is detached from the child, and there's this insecure attachment. So even as the child grows a little bit older, the mom may be telling the child, go over there and eat, go get something over there, go do that over there. And subsequently the child is being very independent, but making the wrong food choices. And we see this coming up over and over again, right? So even when we look at childhood obesity, we also have to pay attention to the correlation of their relationship with their mother or their birthing parent, as well as the mental health of that parent. Talk to me a little bit about your thoughts around these correlations between maternal mental health and childhood obesity.
So we know childhood obesity continues to be an issue. I like to give statistics because it helps you understand the problem we're dealing with. So nationwide, about 16% of children are living with obesity. That's about 14 million. That rate is about 25 to 26% in Latinx and African American communities. So you already see that we are, again, significantly increased. you talk about, when we think about childhood obesity, it begins in the maternal period. So a woman who is living with obesity or a birthing person who is living with obesity during pregnancy, there's a higher risk for the child to be living with obesity after birth. When we talk about breastfeeding, we know that the role of breastfeeding in actually starting that child off on a pathway that actually has a reduced risk of obesity, and then the decreased rates of breastfeeding when that parent is dealing with a mental health issue, right? And then even just thinking about in our community what the barriers are to breastfeeding. So there's so many pieces to that, and I think that when we think about why we see these rates, I think it's really important for us to understand that there's nothing inherently that makes Black individuals, Latinx individuals at increased risk for this, right? So when we hear about issues that are more likely, you think, is there a genetic issue? You know, is there something that gives us melanated skin and full lips and curly hair and then increased risk for almost every other chronic disease that we hear about? The answer is no. There's no genetic correlation. We're actually more than 99.9% the same genetically, no matter what race or ethnicity you are. And so we're dealing with a social construct that has such significant impact. And childhood obesity, unfortunately, is just another condition that we see a unprecedented burden in our community.
Dr. Knight, talk to me a little bit more about what you mean when you said it starts in the womb. So are we talking about gestational diabetes? Are we talking about a mother's, her own eating habits? Are we, what are we talking about when we say that childhood obesity starts in the womb?
It includes all of that. So think about this. You have 9 months, hopefully if it's a full-term infant, you have 9 months that this child is growing in the mother, okay? Or growing in the birthing person. And during that time, everything is affecting. So we're talking about food, we're talking about nutrition, we're also talking about stress. Okay, we're talking about discrimination. We're talking about what that person is dealing with on a day-to-day basis. It is not, it's not by mistake that communities that are dealing with the highest levels of stress, from violence, from police violence, from community violence, from financial instability, housing inequity, pay inequity, are also dealing with increased risk of everything else. So now you have a child that has been growing 9 months in a womb that unfortunately your hormones that are increased because of the stress, the chronic stress, the poor sleep, the issues, that all affects the child's development. And so when we start seeing things like gestational diabetes, which has more of a physiologic trait to a larger infant and risk for C-section and other complications, it's all connected. And so when we have a conversation about infant mortality or childhood health, it has to begin with the birthing parent. It has to even begin preconception. When I have patients who come in that says, I'm thinking about starting a family in the next 12 months, let's make sure the health is where it's supposed to be now. Let's make sure the mental health issues are where they're supposed to be now, because it's just going to be a part of the entire pathway.
That's right. That's right. Thank you, Dr. Knight. Jabina and Sasha?
So I think when we talk about the pregnancy and then we talk about immediate postpartum, a lot of my work is done around breastfeeding. Right, so breastfeeding being the first foods, and as you said, it decreases the risk for obesity. And you mentioned first food deserts. Yeah. So we talk about food deserts, not having, supermarkets that have, fresh foods and vegetables nearby, but we're talking about first food deserts. And first food deserts are not having adequate resources and support for breastfeeding, specifically for Black and brown birthing people. Right, so your doctor isn't aware of breastfeeding. They're not equipped and educated to support you to even talk about what are your first steps, what do you need to do, and then not having support groups, not having people that look like you who are running your support group. And from my experience personally, when I went to an Ivy League institution, I went to a support group that was all white women. And one thing someone said to me was, oh, you're using disposable diapers? And I turned off. And so what I said to myself from that day forward, I would create a support group that was for us, by us, that was not going to make others feel othered. And so first foods are extremely important. Getting information on breastfeeding is incredibly important because, again, that helps to decrease the risk for obesity.
That's right. Thank you, Jabina. And again, I love the fact that you saw that there was a deficit and you were like, I'm filling this deficit, right? I'm creating something so that nobody else has to experience it in the same way. I think that's the beauty about being Black too, right? Like we're just like, oh, I'm gonna create that. Oh, that's missing? I'm gonna create that. I mean, look at all these vendors we have today, right? We're like, oh, I'm gonna create that. My mic keeps going out. Go, Sasha, tell us.
So I can't speak from obesity from a clinical level, but I can speak to it from a personal level. I was an obese child. I was an obese adult. My mother was obese. My grandparents were obese. And so as the doctor mentioned, I don't think that it was a genetic thing. I think it was a lack of accountability thing. And I think even growing up, you know, my grandmother culturally would be like, oh, baby, you know, and as I grew up and became a woman in adulthood and realizing that this was not a path that I wanted to be on and the experiences that I wanted to have. The world is not very nice to obese people. And I think that oftentimes we've kind of, and we won't go into this, but I think we've often created a culture of acceptance or excuses in terms of dismissing our need to get healthy. And so for me, I had to take accountability. I had and really lose that weight and get healthy, as the doctor said, in the experiences that I was having. And so for me, when I had my daughter, I was fortunate to be able to breastfeed for a few months before I got engorged. But for her, that accountability piece comes in as to I am very conscious as to what her appearance is. And I don't mean like she can't gain weight, but I mean in terms of what she eats. I mean in terms of being accountable and like, yeah, she has snacks. She's a kid, but she doesn't need to have all of the snacks. Yeah. She's required to eat vegetables. She's required to exercise. And if she, even during that COVID time, you know, we would make her go outside. You need to run up and down the street. We make her do push-ups, because I want her to be a better version of me than I was. I know how hard it is to lose weight. I know what it's like to be an obese person in this world. And I think that when you don't set your child up on a path to not do that, you are setting them up for a very hard experience in life. And so I try to do the best that I can, even when I was at different salary levels, because as Jabina mentioned, like sometimes we are in positions where we feel as though maybe we can't afford certain choices. Right. But I think it's also that lack of education and understanding that there are things that we can do even if we don't have the money. You don't have to go to Whole Foods. I mean, Walmart has a variety of different things. So there are ways where we can still give our children healthy choices. And so for me, overcoming that personal experience and still fighting that personal experience, because as a doctor, obesity is a disease. Yeah. Like this is not, you know, some fly by the night thing. This is not, oh, well, if you just put the hamburger, this is a real thing that you are fighting. And so I try to make sure that even if sometimes I'm weak within it in myself, that I'm stronger for it for her. So, you know, she is luckily within her weight range, and I plan for her to stay that way. I've made the joke to my husband. I said she could gain weight when she's 18, but as long as she's in my house, she's gonna be in her range.
Not on my watch,
right,
baby.
Right.
It's interesting that we're talking about it in that way too. I nursed both my children for the first years of their lives, and I remember thinking about how they were able to regulate what they were eating, how much they wanted to eat, and also strengthening their neck, right? Because when they were done, they could just simply turn their head away from the breast and indicate that they were done eating, as opposed to if I had been forcing them with bottles and just continuing to make sure like that they eat all of that they drink all of that milk, right? Like I was also inspired because they were learning their first choices. They were having their first choices. Like, I'm done eating, you know, this is over. And I see the implication in that now, even in the choices that they make, especially with my son, where he's like, I'm done eating, like there's nothing else. Culturally, you know, my parents, well, grandparents mostly, let me not say my parents because my daddy's somewhere in here and I don't need him to be yelling at me. Hey, daddy. Mm-hmm. But this concept of you better eat all of that food, those conversations that concept starts when we're first giving them milk also, where we're expecting them to finish their bottles. And that's helping them to it's counterproductive because what it teaches them is you must continue to eat. Even when you are full, you continue to eat. I remember one of the other things is they had to ask permission to go in the refrigerator. And people used to be like, that's kind of mean. Like, why are you regulating them like that? And it was because I needed to have conversations with them before they had all of this food, right? Like, You don't get free reign in the refrigerator because sometimes you might be sad and that's why you're trying to go eat. Or sometimes you might be thirsty, but you're going for food instead, right? So it would be conversations that we had to address that childhood obesity. Yeah, go ahead.
So I want folks to also understand working with folks breastfeeding can be challenging. And so not that we're saying not that you can't feed formula or, provide formula to your children. However, pace bottle feeding. And so also teaching birthing people how to bottle feed. And people are not taught that, right? Like you said.
Tell me. I don't know, Jabina. Tell me.
So you just hold the bottle and it's like this.
Right.
And it's like you wait until this baby is finished. And so
Right.
pace bottle feeding also gives that baby the range for them to pull away, right? So they're able to pull away and you follow their pace. Yeah. And again, they are telling you that I'm full, that I'm done. It doesn't mean when that 8 ounces finished, that's when they're finished. Right. And so that's a part of education as well.
Is there a way that they're supposed to hold the baby so that the baby can actually pull away?
Right, so you hold the baby upright, very similar to in the bottle upright. And the bottle is supposed to really hold so similar to this, right? And so this baby is upright, right? So this baby is upright, and then you hold the nipple right at the roof of their mouth so that they can pull back, right? So they're able to pull back and to navigate and be free range of their head. So if the baby is slumped down like this, it's not gonna work, right? Because they're forced to finish everything in that bottle. And so it's really important to do pace bottle feeding around that time. So it's not like it's not one or the other.
Right. I love this. Are there any questions so far? Any thoughts, questions from the audience? Yes, indeed.
I just had like the aha moment that we're sitting there and you feed the baby and their head's here, so there's nowhere for the head to really go. Mm-hmm. And it was just like, if nobody would have ever said that to me, I would have never known. So you would continue to just keep feeding your baby how you see them be fed and not really take the time to educate yourself. So I appreciate that.
Mm-hmm.
I just had a Hello. I wanted a clarification on when we talk about obesity in the Black community. I'm understanding that often when we talk about obesity, we're using the BMI scale, but that has been revealed that it doesn't account for non-male white bodies. So how are we determining? Hello. Essentially, how are we determining?
I'm sorry about the mic. We're going to change out the mic. But what I hear you saying is when we oftentimes think about obesity, we're using the traditional BMI scale. And what has recently been revealed is that the BMI scale doesn't necessarily apply to bodies like ours. Is that the question? All right, let's start with Dr. Knight, and then we can move our way down.
So that's a great question. So what we know is that the BMI was not created for clinical use, not individual one-on-one use. It was really created to look at a population level to kind of estimate in a very general way what level of obesity could be present. We don't define obesity just as a number on the scale. It has to do with your physical ability, your health overall, mental health is included, how much adiposity, which means fat tissue, is present, and if it's dysfunctional. So when people use BMI in a one-on-one, it's a little bit more challenging. At a very high level, it's able to give us signals with what we're dealing with on a national level. So every person in the country, we can't go through that level of detail to get an idea, but at very high levels of BMI, it can give us an estimation of what we're dealing with on the population health level. Very different with what you would be dealing with your doctor. And so just for those who you may go to the doctor, the only thing you hear is your BMI is this, so you have to do this. That's just the beginning of the conversation. It's much more detailed than that. So that great point to that.
Thank you. Did any of you all want to answer? I know that was real scientific, right? Dr. Knight was breaking it down. Boom, 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 boom. All right. Let's go ahead and ask a couple more questions before we wrap up. So they say that when we know better, we do better. And this concept is even more important for birthing people because they're literally carrying the next generation. And in some situations, they're carrying their own legacy. So knowing better and doing better is vital for the survival of the next generation. What are some things from your own childhood your own birthing phase, or your professional work that you wish you knew, but will ensure that the young people, not just girls, but that young people know that for when it's time for them to give birth, and for the first 3 years after birth as well? You don't have to laugh at the question though, Sasha. Dang. I tried hard on that question.
Because I think that sometimes, my opinion, that people have this perception that having a child, like, oh, it's cute. It ain't nothing cute to me about having a baby. It is a lot of responsibility. And there is a lot of accountability that comes with being a parent. And I don't mean responsible like, oh, I gotta feed them, I gotta clothe them. Like, yeah, that's what you're responsible for. But you are also responsible for their well-being overall, mentally, emotionally, physically, so many different things. And I think we oftentimes remove that out of it, and we don't think about all of those things that it requires to, is your child grounded? In terms of like being a grounded person? Are they able to express themselves adequately? We see often the differences between men and women in expression, and we equate, well, this is a woman thing, this is a man thing, or, but there are plenty of women who can't express themselves adequately either. So, these are all of the things that go into raising a child and being responsible. And I think that a lot of times, like, we don't consider those factors. And so when I think about, damn, I'm sorry, I'm a cusser.
It's okay, girl. We be cussing.
That I wish I would have known is one, like all of the things that I needed to work on within myself, because there were a lot of things that when I was raising my daughter early on that you think that you've kind of overcome something and then something's triggered, or then my household, you talk about corporal punishment, it was a violent household. So sometimes to me, my first response was like violence. And that is, I don't think that should be the first form, when you're dealing with children. So there were so many things that I had to unlearn. And so I feel like oftentimes when we are becoming parents, whether, you're married or not, but you're jumping into these situations and producing these children without taking into account of all of the things that come with it and all of the things that you not only need to take care of within yourself, but for them too. And so that is the part where I wish I had more preparation. I wish I had more resources. No time is ever the right time, but I'd rather raise a child with a little bit more money in my bank account than not. So, there are a lot of things that I think that we fail to look at as a whole. And I wish that we often had more of those conversations as people, as parents, so that we can keep raising more productive children rather than angry children.
I love that you said that, Sasha, because I 100% believe that when it's time to have a baby, when you're making that decision, you needed to do your own work first. You need to assess your communication skills, your problem-solving skills, understanding what your trauma triggers are, understanding what happened in your childhood that you're ready to carry on to the next generation, but also what needs to stop with you, and understanding the intentionality of breaking those cycles. That's hard work to go against how you have been raised or how you have been reinforced to start a new process with a new generation. And again, like you mentioned, a lot of people don't think about it. They just think, I'm ready for the little baby. I got enough money for this daycare. You know what I'm saying? I love this person. Child, please. You hear what I'm saying? It's so much more in terms of who are you as a person, because you're literally giving that to this next generation, right? And are you okay with all of that?
Even what you're showing in the relationship, whether you're married or not. Like, what does your relationship look like? What is that dynamic? How do you communicate with each other? Because I've seen some great co-parenting situations, but I'm a product of a real bad one. So, all of these things should be factors, not just the outfit, right? Or the picture. It's a lot more to raising a kid.
That's right. Go ahead, Jabina.
So I appreciate that wholeheartedly. My children are 10 years apart, and I parented them totally differently. A 22-year-old parent and a 32-year-old parent are two different types of parents, right? And one who had been in therapy, and so everyone wants to hold the baby. Who will hold the mother? Yeah. Really being intentional about that. Yes, that is my term. It is trademark. It is a part of my work. Yes, and because it's so important. when that baby comes, everybody wants to hold that baby. And so not forgetting about the mothers, the birthing people, not forgetting about yourself, not forgetting about your village. That's extremely important. And to speak to the point around knowing yourself, it's so important as we talk about mental health, know where your baseline is. Because with a lot of the hormonal changes and fluctuations during pregnancy and after pregnancy can be a trigger for what happens in that postpartum period. So making sure that you have a village, knowing where your baseline is, because I did it when I had my son, and he would say, "Mom, what's soft parenting?" And
Right.
you know, he was like, "I don't know what kind of parenting you're doing, but it's very different." But I can also parent him as a young adult very differently too. And so it's really important for us to know our baseline.
That's right. That's right. And Dr. Knight, tell us.
Yeah, I think the biggest thing is just community and learning from each other and having those conversations. So even the conversation we're having today, I'm sure someone heard something they've never heard before. These are things we have to be having at the kitchen table, right, at the barbershop, at the beauty salon, at work. We have to have these discussions because, again, so many people are suffering in silence. So many people are not really talking about what they're going through because of that stigma, right? Because it's like, well, no one else is being affected by this, so I don't want to share what I'm going through so that I'm the outlier. And almost everybody around you could be dealing with the same thing. So it's having those conversations with our children as they're growing up in the schools. I mean, we are battling what we could even talk about in school right now. It's having those conversations because our community continues to be, and I want to be careful how I say this, because sometimes you can get into the mindset that says, we're in the African American community, we're in the Latinx community, so we're going to be at the bottom of every statistic, right? And we just have an expectation that we're not going to have a fair shake, we're not going to have that outcome. I think it's a different approach of understanding, yes, there may be the barriers set up against us, so that's mean we need to, even more reason we have to have a plan to overcome that. When we think about the healthcare system, and we have to be, as a part of the healthcare system myself, the healthcare system in the United States is not designed to provide equitable care. It's not. So when we talk about a lack of health equity, we are not talking about a broken system. We're talking about a system that is operating the way that it was designed to operate.
Say that again,
Okay?
Dr. Knight.
So when we hear about disparities in outcomes in health, it's not that the system is broken, it's that the system is operating as it was designed to operate. When the healthcare system was designed in this country, we had white hospitals, we had black hospitals, we had healthcare systems and payers even today, where how you're insured is going to tell you who you can see, where you can go, what medication you can receive. So if we know that there's no equity, how can we be surprised when we hear the statistics that we've just talked about today? And so that means as a community, we have to say, listen, you're about to go on this birthing journey. Let's have a real conversation with what you are going up against, and let's have a plan to overcome that so you can have that successful journey. It should not be, I want to have a family, I want to give birth, but I'm scared for my life. I don't know what I'm going up against. Let's have a motivation to put those systems in place, have those resources that we heard today where we can have those conversations and be healthy as a community, that if you want to give birth, you can do it healthfully. You don't have to think about, am I going to make it out of the hospital? Is my child going to make it out of the hospital? And it sounds so strange, but these are real issues. When I, in my training, have seen young women come in, young people come in to give birth, and they're in the ICU. They are not being listened to. They're not getting the treatment that they deserve. It's a systemic issue, and these conversations just begin. So what would I say? It's collaboration, conversation, and advocating for yourself. If someone's not listening, you get someone who can talk above that noise. It's so important.
And like you said, that sense of community too, right? Which is what we're here for. Like, talk to somebody and listen to the stories that other people are telling you too, because that may give you information to learn how to advocate for yourself as well. Any other questions from the audience? Any questions? Okay, yes, okay. I'm gonna start with you.
My mom is trying to make it seem like my body isn't okay. No, then I always try to be clear. I'm not saying that, and I never use that language. And then I try to educate myself on language that I am using, but I am being honest about like where I don't want you to be or where I don't want you to go. And then I ask her, like if she says, well, I didn't like that or that hurt my feelings, Why did it hurt your feelings? What could I have said better? You know what I mean? And so I do try to give her that space to tell me, you know, that she didn't like that. But I also, you know, have to, if I don't tell the truth to her, like somebody else will. So it's like I also have to be honest, like, you know, listen, like, you don't, or when we go out to eat, you don't need a whole platter. Like, you 10. Like, so, you know, and keeping it like that. Well, I'm still hungry, drink some water. And I do the thing of, she'll eat something, she'll eat it all. And she'll be like, I'm still hungry. All right, you want some vegetables? If she eat them vegetables, I know she's still hungry. Right. So it's like little thing, and you get to know your child, and you know, like she's a very sensitive, very affectionate child. So you begin to understand like what they need as opposed to like another kid you could talk to a little bit differently. But still, I do try to be very mindful because I know it can be hurtful because I know my own experience.
Yeah, thank you, Sasha. Dr. Knight?
Just one quick point. I think it's also important to understand that our children are targeted by companies who sell food that is of poor nutritional quality. When we talk about food deserts, we often say, you know, how many grocery stores are in the community are more linked to obesity rates. And it's actually, there's a stronger correlation with what we call food swamps, okay? So if you've never heard of what a food swamp is, it's an area where there is a larger amount of low nutritional quality food that's very available in correlation to how much healthy food is available, affordable, and tastes good. Okay, so it's a very different concept. When we think about urban communities, it's not that there's no food. It's that there's plenty of food, but the food that's actually healthy is often unaffordable, is priced 5 times as much, and is less accessible. And so when you think about that, why is that the case? It's not a naturally occurring phenomenon. We have companies, because of, you know, just corporate structure, that make food that should be snack food, should be a gift, something that you have every so often, but it's marketed specifically to Black and Latinx communities as everyday food. And so when you think about the cartoon characters that our children like, they're never showing up on the healthy food bags. They're showing up on the fast food. They're showing up on the snacks. So when our kids ask for that, we can't be surprised because they're being targeted, right? Marketing companies know exactly what to do, right? Yeah. So when we think about an industry that is putting hundreds of millions of dollars into marketing to us, and then we see these statistics, we have to ask ourselves, why is that happening? And actually talk to our legislator, talk to our people who make these rules, because there's a lot of things, even in zoning, that allows our communities to be targeted as well.
That's right, that's right. Let's take these last few minutes and give the audience some tips, right? So tips related to maternal mental health, tips related to childhood obesity, and tips related to those of us that are supporting birthing people. So not just tips for the birthing person, but for those of us that are supporting people that are having babies right now, are wanting to have babies right now. And let's keep it kind of concise, because you see this band, they ready, right? So let's keep it concise, but clear.
So I think my tip would be that there is Black vitality, there's still Black joy, because the conversations that we have are still incredibly heavy. So Black joy, Black vitality, we are birthing healthy babies, right? There are statistics, but it's a both and. And so lean into that joy, into that vitality, and understand that you can do it with your community. You can do it with your mental health therapist. You can do it with your village.
Thank you, Jabina. Thank you.
I think the quickest tip would just be do your best to just research plan. Like if there's something you're going through, maybe you don't want to talk about it. I mean, a quick Google search of Black Mom Mother Group, right? You'll find a lot of different things that'll come up now that used to not come up before, especially in this DMV area. There are quite a few groups now here, or even other areas. So just, you know, plan, prepare as best you can, talk to your community, your support. Try to, if you don't have that, do your best to try to find that in other areas. And then also be mindful that just because that person isn't Black doesn't mean that they can't be culturally competent, because I have been able to find resources in people who didn't look like me, which I used to think that wasn't possible. So so just, you know, do your best to try to find what you're looking for and not be afraid to demand and ask for what you need.
I love that, Sasha. Thank you.
My quick tip would just be making sure you have the right team, right? So whatever you're going into, not just family, friends, mental health support, also healthcare, right? Who is your healthcare provider? Is that someone who listens to you? Is that someone who validates your concerns? Having that is so very incredibly different, and having people around you that know how to navigate, that know how to advocate. You know, when we see patients come in who are from other backgrounds, they don't take no for an answer all the time.
That's right.
It's like,
That's
well,
right.
you know, we'll come back. No, we need to see the attending physician right now. We need to see the medical director right now. I got them on the phone. Very different outcome than, okay, you know, maybe because of a literacy issue, we're not comfortable. Have that team. So if you have someone, they're going to go into a birthing experience, they're planning a family, who's on your team? Who is your healthcare provider? Who is your community health worker? Who is your mental health support? Because it's going to be a journey, and we need all the help we can get. We have the resilience. We have the vitality. Even all the barriers we talked about, our community continues to excel, but it's because we work together and we have the right team.
That's right. That's right. I love it. Wasn't this panel amazing, y'all? Right? So again, giving shout out to Jabina Coleman. Thank you so much for being here, sis. And Sasha Nicole, thank you so much. And Dr. Michael Knight. As you heard in the introduction, they all have their own foundation and are doing different types of work pertaining to childhood obesity and maternal mental health. So I encourage you throughout this afternoon to spend some time talking with them as well. Again, shout out to our sponsors, the National Coalition of 100 Black Women, as well. Oh, look at y'all. Come on, y'all. Y'all better be here. And our partners, Woke Media and Neighbors DC as well. So let's go ahead and rock out, and thank you all so much.